Welcome. We started a little bit late just because of the change of diary appointments, which meant the link changed. So apologies, but I'll hand over to Lisa to get going. And if there's any questions, I work in the office with Felicity sometimes, and I also work with Joanne, the CEO. So anything unrelated to this and you want to discuss anything, you can always inbox me. I'll head off at about 11 into another meeting, but otherwise Lisa. And Lisa, do you share the presentation with Felicity at the end?
Yes. Yes.
Okay, great. So you know the slides are also available to you, for your own information. So thank you, Lisa. Over to you. And just make sure everyone mutes if you can, please, unless you have a question.
Thank you, Sarah.
Thank you.
And I'm just going to share my screen with you all. And I do apologise. Sarah was very kind and said it was at their end, but I'm sure it was at my end. So I do apologise for that. Thanks for tuning in and thanks for your patience. I'd like to acknowledge the traditional custodians of all the lands that we're sitting in today and pay my respects to elders past and present. And I extend that respect to any Aboriginal and Torres Strait Islander people who are here today. I'm from the Continence Foundation of Australia, and my name is Lisa Monsell. Sorry, I'm a health promotion person. I'm not a continence nurse advisor, so I can't answer particular questions, but I can give you lots of information. If you have any questions, it might be good to wait till the end because you may find that it's covered over the talk. But if you have a burning question, by all means, ask. And there's also, at the bottom of the screen, there's a little chat button, and you can ask a question that way too. So, good, okay. Now, the Continence Foundation is the national peak body for promoting bladder and bowel health in Australia. It's a not-for-profit organisation funded by the federal government, and the vision of the foundation is to have a community free of the stigma and restrictions of incontinence, not continence, silly old me. So today we're going to talk about what incontinence is, who's at risk, how Parkinson's can affect your continence, what you can do, who can help you, and how the Continence Foundation can assist you. Before I launch into incontinence, let's just make sure we're on the same page with what continence is. So this is when you can control your bladder and bowel so that you're able to go to the toilet to pass urine or a bowel motion at your convenience. Does anyone, or I should, because I've suggested we don't talk through it because it can be a bit tricky, I'm sure a lot of you don't appreciate that your bladder generally holds between 300 and 400 mils. It varies a bit from person to person, and 400 mils is about a cup and a half. And the healthy way to urinate is to be able to wait until your bladder's full before you go to the toilet. And it's normal for people to go around 6 times a day to urinate, and no more than twice overnight as we age. For your bowels, it's different. There's no recommended time or recommended number of times that you should open your bowels. Some people open their bowels 3 times a day. Some people only do that 3 times a week. So it's more important in terms of opening your bowels that it's soft and easy to pass. And that leads us to what incontinence is, and that's when you have an accidental or involuntary loss of urine or bowel motion. This can be a small leak to a complete loss of control. It can be every now and then, or it can be regular. It doesn't matter how much, how little, or how often. If you find that you're leaking and losing urine or bowel movement when you don't mean to, that would indicate you're incontinent. And it's very common. Although incontinence should never be thought of as normal or a natural part of aging or normal after having a baby, what we do know is that it's very common. 1 in 4 Australians over the age of 15 has an issue with incontinence, and 1 in 3 women who've ever had a baby has an issue with incontinence. And I'll talk a bit about why this happens. And we know that because there's a taboo that surrounds talking about defecating and urinating, these numbers are probably higher. If you've got poor bladder control, you may be rushing to get to the toilet on time to pass urine. You may be leaking before you get there. You may be unable to hold on for long when you've got the urge to go. And you may find that you're losing urine when you stand up or get out of bed or laugh or cough or sneeze. You may wet the bed when you're asleep. You may have really poor urine flow, and you may be getting up more than once overnight to go to the toilet. Poor bowel control is when you need to hurry to get to the toilet to use your bowels. Perhaps you find you're soiling yourself before you get there. If you're unable to control wind, and by that I don't mean if you've had lots of baked beans to eat and then you get wind, it's more being unable to control it and for it to be uncomfortable for you around that. The other thing is you may be straining to empty your bowel. And the risk factors for poor bladder and bowel are many and varied. Pregnancy and childbirth are big risk factors. That's why there's more women than men who have issues with incontinence. And I'll show you a slide later on that'll make that a bit more obvious. It's the pressure of carrying the baby that is put on your pelvic floor that weakens the pelvic floor muscles. When women go through menopause also, we stop producing estrogen, and that weakens the pelvic floor muscles and makes the bladder less elastic, so it's difficult for it to stretch, and that increases the urge to pass urine more frequently. If you're overweight, it can have a big effect on your continence because, again, there's that pressure being put on those pelvic floor muscles. If you're constipated constantly, that can also affect your bladder control because your bowel is holding a weight, and that will press on your bladder and make a problem there. Health conditions such as Parkinson's, multiple sclerosis, things like arthritis, diabetes, chronic heart problems, dementia, if you've had a stroke, prostate problems, all of those things can affect your continence, as can surgery in that part of your body and radiotherapy and chemotherapy. For men, as they age, their prostate often increases in size, and a man's prostate is just under the bladder, and that can push on the urethra, the cord that brings the urine out of the bladder, and so it can make problems with urinating. With Parkinson's, muscles and joints are affected, making it harder to walk and exercise, slowing down bowel motions and leading to constipation. It can reduce your movement, causing difficulty to go to the toilet, or to get to the toilet rather, and remove clothes fast enough. The need to pass urine often and urgently, and only small amounts, is related to the changes in the level of dopamine affecting the function of the bladder muscle. Parkinson's is also thought to affect the nerve pathway between the bladder and the part of the brain controlling bladder function. So bowel function and poor coordination mean that the back passage muscles cannot be working effectively, and this can cause constipation. This is a picture that might be difficult to make much sense of, but it talks about dopamine replacement therapy, levodopa. When Parkinson's medication wears off, it can affect bladder and bowel function. So you'll see on that graph, it's a wavy line, and at the bottom of the wavy line is when the medication has worn off, and that means that the dopamine levels changed. So it's really important to remember to take your medication on time, because this can help reduce the effects that we call the wearing off effect. There are medical or the medication for Parkinson's sometimes taken can affect your sleep, and there can be a buildup of extra fluid during the day and filling your bladder at night, causing you to get up to go to the toilet, which is called nocturia, often. And this is caused by fluid reabsorption when lying down. That wearing off effect of the medication can also make for an increase in frequency and rush. Chewing and swallowing difficulties with Parkinson's would mean that you'd also experience problems with eating enough dietary fibre and drinking enough fluid daily, and that can lead to constipation. Well, both of those can lead to constipation. Underlying conditions that you may already have on top of Parkinson's can be things such as weak pelvic floor muscles, or an enlarged prostate, adding to bladder symptoms. The constipation may make bladder symptoms worse by putting pressure on the bladder, as I mentioned before. And some medications that you're taking to manage urgency can also cause you to hold on to urine. I'm going to talk now a bit about some healthy habits, just general healthy habits that will assist your bladder and bowel function. It's really important to drink so that you don't feel thirsty. When you begin to feel thirsty, it means you're becoming dehydrated. And that's different for every person. The best evidence that there is that water is the best drink. Now, you don't need to buy it in bottles. It's available, from your tap for free. If you can encourage the drinking of water through the day, that'd be really helpful. But fluid also is available in fruits and vegetables and lots of other foods like soup, juice, milk, anything. As I said, the important thing...
Yes, it is. I'll catch you later, Lou.
Okay.
Bye.
So the important thing is to try and drink enough so that you're not becoming thirsty. And an easy way to do this is to place a jug of water on a table next to someone, and just so that it makes it easier. If if there's a sucking reflex problem, a straw could help. And if swallowing's a problem, thickened fluids may be more useful, but this would all be recommended by a health professional. There are some drinks, though, that irritate the bladder and that make you have the urge to go to the toilet before your bladder's full. And these drinks are drinks with caffeine in them. Coffee, tea, energy drinks, you know, like Red Bull, that sort of thing. Soft drinks, the carbonation irritates the bladder. And I'm sorry to say alcohol, that also irritates the bladder. So, of course, you know, it'd be mad to say cut all those drinks out. But if you think on reflection that you're drinking quite a bit of them, it could be a good idea to try and cut back a bit. The picture on the left-hand side of the screen shows you a sort of mock-up of a colour of urine. Your urine, if you're drinking enough, is a pale yellow colour, like 1 or 2. If it's really dark down the bottom, that indicates that you may be dehydrated and you need to drink some more. Or it could also mean that you've eaten beetroot, or I don't know if any of you have ever eaten asparagus and noticed it changes the colour of your urine and makes it smell a bit. But the other thing also is some vitamins and medications can change the colour of your urine. But if it's because you haven't drunk enough, being dehydrated and having concentrated urine can lead to things like urinary tract infections. And that can be where a problem suddenly escalates. So it's really important to try and be drinking enough so that you don't become thirsty. Eating dietary fibre, as I said, sometimes is difficult for people with Parkinson's, but if you can eat a balanced diet that includes fibre-rich foods and lots of fluids and manage to move a bit, that'll really help to keep your bowels healthy and regular. Fibre is only found in plant foods, and it's recommended that we eat 5 serves of vegetables, 2 serves of fruit, and 5 serves of cereals and grains a day. So that's a lot. We've got a little booklet called Diet and Healthy Bowels, and I'll put that on a resource sheet that I send around. That'll help you with that whole area of what a serve size looks like and all of that. The other thing about having a high fibre diet is that it can help protect against chronic diseases such as heart disease and type 2 diabetes, and also help with weight maintenance. And that's important, as I spoke of before, because when you're carrying too much weight, that weight presses down on your pelvic floor and can affect your continence. This lovely chart is called the Bristol stool chart, and this is a good way to keep on top of what's happening with your bowel. So constipation is a really common issue for many people with Parkinson's, and it's important that you seek help to manage your constipation, because if left untreated, it can lead to several problems, such as nausea, lethargy, and an impact on your quality of life. Also, sometimes severe constipation can mimic diarrhea, and it looks like you're having loose bowel motions, but this is because there's a bit of overflow happening, and that's not good. The first 2 diagrams, type 1 and type 2, show very hard and dry stools. Number one, particularly the bowel motions look like little hard pebbles. And type 2 is formed in a log, but it's very cracked and dry on the outside. And these bowel movements are probably looking like that because there's not enough fluid in the diet. At the far end of the chart, number 7, that's where there's a watery diarrhea, almost entirely liquid. And that can be very dangerous because you can dehydrate very quickly, and it may be masking something like food poisoning or some other issue going on, and that's important to have a doctor look at. Not look, well, you know what I mean. Look at you. The ideal stool or bowel motion is type 3 or 4, and to imagine that, I want you to think of the last time you went to a Bunnings sausage sizzle. So that's what you want, something that's smooth, not much cracking on the outside, and something that's easy to pass. The 2 bowel movements under those are looser and with soft edges, and these are probably indicating that there's not enough fibre in your diet. And as I said before, people go to the toilet or open their bowels in different ways individually. What's important to keep an eye on is if your regular habit changes. So if you're normally a type 3 kind of a gal and suddenly you're type 7 or type 1, then that's indicating to you that there's a problem. And that's how you know that you should attend to it. Being active is really important to prevent constipation. If you can integrate some kind of physical activity into your day, whatever is possible, it would be really beneficial in terms of constipation. I would, of course, say that you should have some sort of physical assessment before you launch into anything, and any kind of movement is good. I'm certainly not talking about joining a boxing team. It's also good for maintaining a healthy weight. Now, nocturia, as I spoke of before, is when you're getting up often through the night to urinate. A good tip for this is to have a rest in the afternoon with your feet elevated, and that allows excess fluid to be reabsorbed, reducing that urge to go to the toilet. And if you find when you think about it, you drink quite a bit before you go to bed, well, then that, of course, will have an effect too, and it might be worth cutting back on that. Because caffeinated drinks irritate the bladder, making you have the urge to urinate, it could be good to stop those if you can after 5 o'clock in the afternoon. And if you can sleep close to a toilet or use a urinary bottle, that can be useful in terms of lessening the chance of you falling over or having a problem getting to the toilet when you're not quite awake. Some medications may assist with bladder and bowel control, but can have side effects, such as worsening of other Parkinson's symptoms. There may be confusion involved and that dry mouth. So always check with your health professional before using laxatives or prescribed medications. These diagrams show a side view of a man and woman, and I'm not going to tell you which one's which. The pelvic floor muscles, which I've spoken of a bit, are that red line across the bottom of the trunk, and they're held just above the pelvis. I'm going to show you an animation in a minute that'll explain that a bit more. Because of their position and the fact that they have the openings for both bladders and bowels, and for a woman for her uterus where a baby is delivered, the openings through the pelvic floor are really important to have toned so that it can mean that it's less likely you'll leak. I'm just going to show you these animations now because I think this explains things much better.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back, and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina, as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles, they tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Sorry, we'll give the boys a go now.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder and bowel and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around the base of the penis, as if you are trying to stop the flow of urine. You should see your penis draw in and your scrotum lift up. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice, as the pelvic floor muscle tightens, the anal passage closes. The same action happens to the urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Now, of course, it may not be possible for you to exercise your pelvic floor, but someone like a women's health physiotherapist or a pelvic floor physiotherapist, these people have been trained in how to assist you with that. And I'm sure you'll appreciate, after having seen the bladder and bowel and everything sort of packed into that area above the pelvis, the poor old pelvic floor muscles have really got their work cut out for them. And it really is important to try and keep them toned if possible. There are some toilet habits that are useful in terms of continence too. It's important to go to the toilet to urinate when your bladder feels full, but you don't want to do things like hover over the toilet or be going to the toilet just in case, because these are not great toilet habits. When you feel the urge to open your bowels, you shouldn't put that off, because that can lead to constipation. Also, wiping your bottom from the front to the back after you've defecated is important, because it lessens the risk of cross-contamination. And having a stool at the base of the toilet, as you can see in this ad, helps to get your body more into that squatting position. What you're after is trying to get your knees higher than your hips, and you keep your back straight but leant forward with your arms on your knees, and that actually really helps with opening your bowels particularly. Sometimes though, many mechanisms of Parkinson's affecting the bladder and bowel health are not reversible, and continence products may be the best option after other areas have been exhausted. There's a video on the website that shows you a range of continence products and how to choose them. That's done by a continence nurse advisor. It's really important though to not go straight to a continence product if you're having a problem, because a continence nurse should really be seeing you and advising that, and also that person, that specialist, can fit you for the most appropriate product. Also, the continence nurse could speak to you about what financial assistance is available for continence products. If you leave incontinence untreated, it'll usually get worse, not better. So it's really important not to put up with it. The first thing to do in terms of not putting up with incontinence is to organise to have a continence assessment. So this would be if you were rushing to go to the toilet, leaking before you get there, losing urine or bowel motion when you laugh or cough or sneeze, having trouble passing urine and straining to empty your bowel. Only a health professional can assess you for continence, and this means that they can look at all possible causes of the problem, and from there are many different treatment options. There may be the chance to cure the incontinence, or at least better manage or treat it. And at an assessment, you get help, as I said before, with advice on products and aids and the financial assistance for these. Please see a doctor or go to the hospital if suddenly you can't pass urine. This may be an infection or a medical emergency. Sometimes what happens is the bladder is drained, but of course then it has to be assessed for why this happened. If you've got stinging or burning when passing urine, this could possibly mean that there's a urinary tract infection, which can quickly escalate. If you're constipated, there are many possible causes for this, and it's important to see someone and have that assessed properly. And if you've had diarrhea that lasts for more than 24 hours, go and see someone quickly, because this could be masking something like food poisoning or another medical emergency, and you can again become dehydrated very quickly. The people to seek help from are a doctor. If you organise to see a doctor, make sure that you ask for a longer appointment, because an assessment can take longer than the 15 minutes you often get. A continence nurse advisor is pretty much the specialist in the field. A pelvic floor physiotherapist can be really helpful, and a pharmacist can help in terms of adjusting medications that perhaps have caused or aggravated incontinence. You can find out where local service providers for these areas are by calling the Continence Helpline. This is a service that the Foundation staffs for the federal government. It's a 1-800 number, so it's free to landline calls. There's a slight charge for mobile phones. It's staffed by continence nurse advisors, and it's open from 8 a.m. until 8 p.m. The continence nurse advisors can provide information and advice to callers living with incontinence or who are caring for someone with incontinence, as well as to health professionals. They can speak to you about diet, medications. They can let you know what financial help is available if you need to have continence products. These can be expensive to purchase, so if they're going to be needed in the long term, it's really important to get the financial help from the government that's available. There's a website, the Continence Foundation, www.continence.org.au. This is where you can find a range of information and literature on bladder and bowel health. There's a section on Parkinson's disorder. You can download information, you can order it to be delivered to you for free. And there's a function that will translate the fact sheets into 29 other languages if English isn't your first language. There are also little embedded videos on there about things like skincare and the NDIS, a whole range of things, because it can be tiresome to read lots of information. This may be an app that would be really useful for you. It's called Continence Support Now, and you can download the app for free and put it on a mobile phone or an iPad or a computer, and it covers topics such as skincare, assistive technology and products, bladders and bowels, catheters, diet, mobility and care plans. It was designed for people who work in aged care initially and for carers, and it's a great way to get immediate practical instructions and videos on various topics. It's not to replace a nurse, and it does give warnings when treatment needs to be escalated. I don't know if any of you know of the public toilet map. It's a federal government initiative. There are 19,000 public toilets across the country listed. You go to a place that you're unfamiliar with, type in where you are, and it'll bring up a map showing you where the public toilet facilities are, opening hours, whether they've got disabled access, all that sort of thing. And that too is free. And if you're having problems with needing to urgently use the toilet, it'd be great to get an MLAC key. It's a master locksmith's access key. You need to have a form signed off by a doctor or a continence nurse saying that you need to use the toilet urgently or often. And the key gives you access to all the disabled toilets in the country 24/7. This is really important because these toilets are often larger. There's room to clean up. Some of them have even hoists and changing tables. Because it's a master locksmiths, or the master locksmiths make the keys, there's usually a charge for the key, and I think the highest charge is $20. But if you were having a problem with continence, having access to decent toilets would be really, you'd make up that $20 very quickly. And that can be downloaded from the National Toilet Map, or also by contacting your local council. I will share with Felicity, who will then share with you a list of all these resources. So if you haven't scribbled down everything, please don't worry. Now, here's the number of the National Helpline again, 1800-330066. As I said, the continence nurses on the end of this call should be a great resource for you. It's the first step in where to go to get help. Now, hopefully I've stopped sharing my screen and I can see some of you. And I wonder if you have any questions for me or comments. And don't forget to, perhaps if you put your hand up and wave it, I can call you out. And don't forget to take your microphone off mute if you want to ask a question. Don't rush me. Yes, Marie.
I don't have any questions, but this has been so informative.
Oh, good, good.
Thank you very much.
Oh, it's my pleasure, Marie, and I will send around all those resources. I mean, if you've got access to the internet, let your fingers do the walking, not the working. There's, I think, if you've got the helpline number, that's the best thing for you. Yes, Susie.
Yeah, me too. Has been very informative. Actually, I attended one before, but probably this one helped to see things more.
Oh, good. I'm so pleased.
Yeah, I remember I saw it. The number is very helpful because actually I'm here for my husband, but it seems that I'm affected too. So.
Right.
In my case, that I have no Parkinson, I can call the organization and see,
yes,
to talk to a nurse or something. You know?
And just for peace of mind, Susie, I think it's really good. It's confidential. They don't take any details. They don't chase you up or anything like that. So it's a really good way to explore what you should do next. It takes the fear out of it, I think. I'm glad you've used it. Thank you.
To have the assessment, as if they assess the doctor, is on the phone. Is possible to do it, or you have to have?
It's not really possible on the phone, Susie, because the continence nurse, and I mean, of course, a doctor can do it too, but continence nurses are trained in that.
Yeah.
They're specialists in just that one area. And sometimes they need to, it's that face-to-face thing where they can look at everything that's going on and also find out things about your medications, the medications you're on, and the frequency or any other sort of issues, because sometimes it can be a matter of adjusting a medication, and they're specialists in that. So the helpline is really good for finding out roughly what you should be looking at, who you should be seeing, and where those people are that are convenient for you to get to.
Great. So we can organize an assessment on the basis of the phone call.
Yes, yes. And they can also, the continence nurses also speak to you about if you're on my aged care, you know, what the, how you go about that, lining it up, and whatever health cover you have, or if you're on NDIS, all of that thing, it's all so complicated, but the nurses know how to link you up with the best way to get help.
Okay, thank you.
Yes, Ruth.
Well, I have had a DVD years ago where they showed you lots of exercises for incontinence and getting that muscle working again.
Yes.
So is that something that your organization could provide again?
If you,
I don't know
yes.
where it is.
If you go onto the website, are you on the computer? I mean, you're on the computer, I can see that, sorry. But are you okay with the internet?
Well, my husband is saying that.
Okay. So if you go onto the Continence Foundation's website, so that's www.continence, continence.org.au.
Yep.
That and then there's a search box, and you can put into that pelvic floor, and that'll show you where things are listed. But in this, actually what's easier is I'll send out the information sheet, because then all you have to do is click on a link.
Okay.
And that'll show you again that the animated thing of the pelvic floor, you know, moving around so you can see what's happening. And there's also another app that shows you how to exercise safely and look after your pelvic floor. But what the pelvic floor physiotherapists have said to me is that a lot of people can't work out how to activate those muscles, so they may need help with that. And it's a pelvic floor physiotherapist who's trained to do that. If you can work out how to do it, it takes about 2 months before you can notice a change. So don't expect a change overnight. And a little tip for that is, when you're doing the exercises, it's actually, you should still be able to breathe properly. You shouldn't be, you know, going like that. It shouldn't look like you're doing anything. So it can be good to do it in front of a mirror. And it's actually easy to do it lying down when you start off, because there's no pressure on your pelvic floor, and you can sort of close your eyes and concentrate on where that is so that you get a feel for it. A pelvic floor physiotherapist, though, would be able to determine whether those muscles are working, because with Parkinson's, as we know, the muscles are often affected. So it may need some sort of more specialised intervention.
Okay. There's another question.
Yes.
I did wonder if VisiCare, the tablets, which should control the urinating and so on, if you take them for a long time, does that have side effects? And
that would be a question for a continence nurse, Ruth. I'm not qualified to answer that, I'm sorry. And there may be, because individuals have different things going on with them at a time, maybe that may be better answered by looking at the whole medication history. So give the helpline a call, and they may give you a better answer. Now, Diana has just put up the pelvic floor first link. Thank you, Diana. If everyone goes down to that chat section on the bottom of the screen, if you put your mouse over that, there's a little box that says chat. And if you bring that up, Diana's put in the web link. So you could start as soon as we finish.
Okay, right.
Yes, Mari.
I want to add that if you by a care and you explain what you're going to do.
We can't hear you, Mari. Can you speak up? Sorry.
If you ring my aged care, they will, and tell them the problem you're having. If you've got a client number, you just tell them that. They will organise for the physiotherapist to come to you. Now, I don't have Parkinson's, Helen does, but they've organised for a physiotherapist to come and see me for my back.
That's right.
A bit of money for it, but it makes it so much easier for you when you're caring for somebody else if you have Parkinson's yourself. My aged care will step up.
Thank you, Mari. Now, I think because I've got such a loud voice, got 6 brothers and sisters. If anyone didn't hear what Mari was saying, she said, if you need a continence assessment, to ring up my aged care and they can book you in. That's right, isn't it, Mari? Is that what you were saying? Yeah.
Yeah, they'll come out and they'll talk to you, and then they will organise for a physiotherapist to come.
Yes, yes. So they can organise the specialised physiotherapist too. But for the pelvic floor, it's not just any physiotherapist. They need to be trained in the pelvic floor because it's quite specialised training. But that Diana put up the link for the pelvic floor first. That's the Continence Foundation's sort of website on the pelvic floor. I'd encourage you to give it a bit of a go. Like a lot of sort of lifestyle things we do, the biggest thing is to get into the habit of it. You've got to sort of get it under control, how to do it. And then if you can link it into your daily habits, like I do mine in bed before I get up in the morning, because in a way it's a way to sort of get me on my feet. But you can do them anywhere. You can do them sitting on a chair, sitting in the car, standing up, lying down. You don't need any equipment to do your pelvic floor exercises if you can activate those muscles. And I'd really encourage you to give it a go and then try and knit it into your daily activities. A lot of people do them when they're waiting at the traffic lights or hanging out the washing. It's just making it regular so that you don't have to think about it. And what's generally recommended, and it depends on lots of individual factors. What's generally recommended is that you try and do 3 sets of 10 exercises a day. That's just lifting your pelvic floor up, holding it, and then letting it go slowly. If you do that 10 times, 3 times a day, that's the thing that sort of gets you toned up.
Right.
Any other questions? Well, you've been a fantastic group. Thank you very much. I really appreciate that you were so patient. And again, this technology, I thought I was over being bamboozled by it, but obviously I'm not.
No, that's fine.
And the Parkinson's support groups are fantastic, aren't they? They're the people who work in the organisation are so helpful, and I've had a very productive relationship with them through the Continence Foundation. And I'd encourage you all, go onto the Continence Foundation website, get all that stuff sent out to you. It's government funded, so we've already all paid for it. But you know the story, if you don't use it, they'll close it down. So make the most of what's available. And if you've got a problem, or if someone you're caring for has got a problem, at least bring up the helpline and speak to a continence nurse.
Right.
Okay. Ruth, you look like you've got something else to say.
Well, it's just that sometimes I can control the pelvic floor and I don't have an accident, but it does happen sometimes where I just,
Yes.
I know I haven't got my bladder full,
Yes.
but
Yes.
I can just not keep it. And
Yeah.
that has to go sometimes very quickly, say for a bushwalk or whatever, it can come on.
Yes.
And if I don't drop everything, I'm just going to wet myself.
Yeah. And
that's
I think,
very embarrassing.
yeah, I think with that too, once you, if you can manage to get your pelvic floor toned, then when you can feel a problem coming on, you can, what the physiotherapists call switch your muscles on. So you're able to draw in and hold on, and that becomes better with practice.
Yeah, so it's a practice.
So good luck. But wonderful that you're bushwalking.
Oh, yeah.
Yeah, great. Great.
That's our exercise.
That's good. A great place to be. Watch out for the fires in summer.
Oh, yeah. Or the leeches in the wet weather.
Oh. Nature.
That doesn't worry us anymore. There's always a little bit of salt in the pocket. So
oh, good. Clever.
Thank you very much.
Thank you very much, everyone. Goodbye.
Bye.
Bye, Lisa.
Bye.